Welcome to the Limitless Ladies Network, a women's holistic wellness podcast where our mission is to help women build holistic self-care. The following disclaimer applies to all episodes and content shared on this show. The views and opinions expressed on this podcast are those of the host and guests and do not necessarily reflect the views of Limitless Ladies Network or its affiliates. The information and advice provided on this podcast are for general educational purposes only and should not be considered as professional medical, nutritional, or therapeutic advice. The content shared on this podcast is not intended to diagnose, treat, cure, or prevent any disease or health condition. Listeners are advised to consult with a qualified healthcare professional before making any changes to their diet, lifestyle, or health routine. By listening to this podcast, you acknowledge that you are aware of the limitations and potential risks associated with the information and advice shared on this show. You release and hold harmless Limitless Ladies Network, its hosts, guests, and affiliates from any liability for any damages, losses, or injuries that may result from the use of the information and advice provided on this podcast. Today I want to talk about our gallbladder and self-advocacy. Self-advocacy is so important when dealing with any medical profession and your own health and well-being. I have recently been struggling with some health issues that appear to be around my gallbladder. I've had some right abdominal pain that goes down. It's like a tightening. It goes down on my side, kind of goes around to my back. So those are my symptoms. They've slowly been creeping on probably for about a year now. And so, of course, I go to the OBGYN office to have them see, because it is cramping. So not sure if that's what it was. Nothing there. Also went to see a urologist because maybe they thought it was a urinary tract infection or something along those lines. Nothing there. Then go to a few other specialists, of course, get a CAT scan of various different types multiple times for them looking for gallstones, kidney stones. Nothing like that shows up. So I'm still left again without getting answers, but was directed to see a surgeon because I did have some swelling in that area that they found through some of the testing that they did do. So things were not normal, but they yet didn't have any true answers as to what the problem was or what it might be. So I went today to my specialist surgeon who was talking to me about my gallbladder because I do have some gallbladder polyps, which they told me would not cause any severe pains. And I was really holding off on going to see this particular person. However, I ended up in the ER last night with severe pain. And lo and behold, they did not find any major issues there either. They did some general blood work, but after that, I just waited it out, felt a little bit better, went to the surgeon's office today. And of course, they wanted to talk to me about, my symptoms, which I explained. I shared with them all of my previous scans that I had done, the results from my blood work. And she felt around a little bit in my abdomen, talked about my symptoms for a few minutes, and decided that, it's most likely that I need to have my gallbladder out and removed. And said that it could be a genetic thing. I'm not sure I'm really buying that. I'm a pretty healthy eating person. If you know me, I don't eat any processed foods. I am organic. I have salads most days. I don't eat a lot of red meat, so I don't have a high fat diet other than like good healthy avocados and some good fish. So anyway, she doesn't ask me about my diet at all, but does say that their purpose is really for them to consult with me on removing my gallbladder. And my response to that was, I'm going to keep my gallbladder. Thank you very much, because it has a very important function. Despite the fact that more than 50% of women in this country have their gallbladder removed, it is a significant organ if you don't know much about it. It's a very tiny pear-shaped organ that kind of sits underneath your right side of your rib cage generally. It is responsible for helping to process fats. Anytime that you eat a fatty burger, French fries, anything like that, your gallbladder helps to process and release some bile in order for your body to be able to fully pass that through your system. Well, that sounds pretty important to me in case you ever have anything fatty, whether that's avocados like me, good healthy fats I want to be able to eat. So my response to her was, no, I want to keep my gallbladder, thank you. And what other alternatives do I have? And she said, well, we could run this other test if you'd like to really see what the level of functioning of your gallbladder is. And I'd have to drink something several times, I think. Then they kind of see as it goes through, is it functioning? Like they give me something really fatty, it sounds like. And then they kind of gauge what the production of it is as it's supposed to be squeezing this bile substance into the proper area for me to be able to digest it. And I said, well, yes, of course I want to do that test before you just start slicing into me. So we're going to have that test done and see where that goes. I also asked about supplements or any other, suggestions on being able to really keep this organ within my body. She had just said, eat small meals, drink water, don't have alcohol, which I don't really do at all anyway. So she pretty much told me the things that I'm already doing. And then supplement wise, she said there's not really any good supplements that are out there either, that they know of that would possibly help. Well, there could be some. I've doing a little bit of research on these things myself, and I'm not giving out medical advice, but I'm trying ox bile because that is bile, so it might help me to digest. Started that today and it felt better. After I ate something, which is the first time in a while that I've been able to eat without having like massive side pain within minutes of me eating. So I'm happy for that because I've already lost 10 pounds within the last almost month since it's progressively gotten more intense. So my advice to you is if you're having right side pains that are shooting down into your hip, can go up to your shoulder as well. Those are symptoms generally of having a gallbladder issue, possibly gallstones, maybe kidney stones, possibly. I would suggest eating small meals, absolutely cutting out on any processed fats that you have as well, and drink lots and lots of water and exercise. Movement is key. Don't be stagnant and stale because that will not help things to move along. But the major piece of advice that I do want to share with you is you have to advocate for yourself. Do not just let them tell you that they're going to cut out a piece of your body that is highly functional in processing your food. I've done lots of research on this over the months since I've been kind of working through this issue. And I'm just blown away by the fact that in some articles it says it's just an organ that you don't need. And I'm like, how do you say you don't need it? It is super important in order to help us to process and digest properly. So my advice to you is if they say we're going to cut out your gallbladder, at least ask for this additional test that you can take. That, and I forget the name of it, so my apologies for that, but it is something where you're gonna have to swallow a bunch of probably fatty type liquid, and then they just scan to see what your actual function is. So might as well get the results of that type of test to see truly what the functioning level of it is before you just up and cut it out, right? So remember, advocate for yourself. If you don't, who else will? Keep following us. Stay tuned. We'll see where this journey takes me, as I'm sure I'll be sharing it at some future point in time. Give us a thumbs up, share in the comments if you've struggled with the same issue. Have you had your gallbladder out? What has it done for you? How do you feel about it? And maybe you wish that you would have known about this particular test before you actually had it taken out.